I'm Dr. Mark Kolich. I'm an orthopedic surgeon and hip and knee specialist here at OrthoNeuro. I was born and raised in Ohio. I was fortunate enough to do all of my training in the state of Ohio. I grew up in a small town called Salem, Ohio, and graduated from high school at Salem High. I then went on to completing my undergraduate studies at Kent State University in Kent, Ohio. I then went on to complete my medical school training at Ohio University Heritage College of Osteopathic Medicine. From that point on, I went on to a surgical residency within orthopedics. That was a 5-year orthopedic surgery residency in Canton, Ohio at Altman Hospital. From that point on, I decided to undergo a hip and knee fellowship. I completed a adult reconstruction hip and knee fellowship in New Albany, Ohio, specializing specifically in anterior-based muscle-sparing approaches for total hip arthroplasty or total hip replacement, as well as partial knee replacements and less invasive total knees. So I treat patients that present with hip or knee complaints overall, and the majority of my patients have some form of hip or knee arthritis, but I also treat patients that have issues along that spectrum prior to requiring any hip or knee arthroplasty procedure. Some patients can have knee sprains, meniscal injuries that often are able to be treated non-operatively or potentially with arthroscopic meniscectomy. But overall, I see the majority of my practice is patients with hip or knee complaints. I became a doctor because it always made sense to me. From a very early age, I was exposed to a family that was very involved in the field of medicine in some way, shape, or form. It was the most intriguing thing for me moving forward, going through school. I always found science to be my favorite subject, and I became very passionate about it, and it had always made sense to me. And I knew that I was going to be in some form of the medical field. I didn't know exactly, where I would be or what I would be doing, but I found orthopedics to be the most gratifying and made the most sense to me moving forward. Being a very visual and very hands-on type of person, orthopedics just made sense. So my favorite part about being a doctor is caring for patients, and this is something that developed, being in practice, is seeing a patient, offering them my service, seeing them do well, seeing them go home and potentially talk to their family or their friend, and then seeing them in the office as well because the patient is satisfied and is overall going back to living their life, and I've been able to help them. So it's been very rewarding to me to build relationships, not only with my patients, but my patients' family and my patients' friends. So my treatment philosophy is, overall I have a growing passion for the field of hip and knee arthroplasty. I'm very passionate about the ability to perform rapid recovery protocols so patients are able to get home quicker. I love the idea of the advancement in some of the technology that we're utilizing, as well as the robotics that we're using, and just staying up to date, with everything that's going on within the field of hip and knee arthroplasty to make sure that we're offering the best possible care and staying the most current.